Hello and welcome. I am Ashok Rajguru, your instructor. The review topic for this module is about symptomatology, pathology, and pathogenesis. The objectives of this lesson are, first of all, to understand what is meant by pathology. Then we will try to understand what is meant by pathogenesis. Then we will understand what is the difference between morbid anatomy and pathology, because these terms are used interchangeably and confusingly. The next thing that we look at is what is the relationship between a remedy and pathology, pathogenesis, and morbid anatomy, and how it can guide us to the correct choice. And lastly, we will look at the importance of provings in order to understand the true meaning of pathology, pathogenesis, and the relationship of the remedy concerned. Let's first take a look at the contemporary definition of pathology. Here is one from the Oxford Dictionary. It says that pathology is a branch of medicine that deals with laboratory examination of samples of body tissue for diagnostic or forensic purposes. In other words, it's just a chemical examination of the chemical contents of some samples of body tissues. It doesn't mention anything about disease, about the person, about the suffering, nothing at all. Here is another definition taken from the Merriam-Webster's dictionary. This one is even more interesting. It says it is a deviation from an assumed normal state of something non-living or non-material. In other words, if there is a deviation of some parameter, say like blood pressure or creatinine in a urine sample, from an assumed normal state, then it will be described as a pathology. So let us first take a look at where does this word pathology come from. It comes from the writings of Hippocrates, the great Greek classical physician who is also known as the father of Western medicine. What he had said was that for a person in disease, there are two important things that are happening at the same time: pathos and ponos. It is from pathos that the word pathology is derived. Let's take a look at these two words. Pathos is the experience that a patient or a person undergoes in a diseased state. It is also a description of the suffering. In other words, all the subjective symptoms, descriptors, changes in behavior, the modalities, like changing of posture or effect of the change of temperature, all these are something that are experienced or suffered by the patient. And that is what pathos is all about. So pathology is actually pathos plus logy, which means the science or understanding of this particular process. Compare this with the definition that we saw in the previous slide. The two don't seem to have absolutely any relationship at all. The second important word that we must understand if we are talking about pathos is the word ponos. Ponos is a Greek word which describes the toil of the body or the amount of effort that the body or the life force has to do to overcome a particular disease. As all of us understand, a disease is really an adaptive response. If the body is invaded by, say, some kind of an infective agent, then the immune system of the body will react in order to drive that pathogen out of the body. In other words, the fever, the inflammation, and all these things are really related to the adaptive response of an otherwise healthy body. Ponos at the same time is something that is measurable. So while the body is fighting or toiling to overcome the state of disease, you will be able to measure the change in body temperature. Fever, for instance. You will be able to measure the blood pressure, for instance. So PONOS is something that is measurable, and it is the adaptive response. Now, when we talk about laboratory findings, blood pressure, fever, chemical content of body samples like fluids, like urine, blood, they relate to the word PONOS. So just think about the word pathology and its current use and refer back to where this word is derived from. Let us see what one of the great masters of homeopathy, Kent, has to say about pathology. And Kent is often considered to be a person where people think that he was talking more about symptoms and less about pathology. That is a misconception we have in our minds. Here is an extract from one of his lectures on homeopathic philosophy, and they deal with the 10th and the 11th aphorism. And this is what Kent has to say. He mentions that as a homeopath, we must become conversant with symptoms to judge the sphere and progress of the disease. So whenever we are handling a symptom, we must come to know which sphere do they belong to. Is this a mental symptom? Is it a physical symptom? Is that symptom related to the PONOS? That means the response, adaptive response of the body. The next thing that he mentions is that we must study the symptoms by becoming well conversant with the nervous system. This is extremely important. Let me give you an example. For instance, somebody mentions about a tingling sensation in the little finger and the fourth finger. And there is another patient who complains about a kind of a pain in the thumb. Now these two pains can be used or cannot be used effectively unless we understand where they originate from. Supposing this patient is having a herniated vertebral disc in C6 or C7, we will be able to discriminate between the sensations felt in the little finger and the thumb, because each one of them belongs to another dermatome. So we must have a good understanding of the nervous system in order to understand sensations, pains, etc. The third important point is that when we study the symptom, we must be able to understand it in terms of the pathogenesis. What is the stage of the disease? How is the disease evolving? That is what pathogenesis is all about. How is the disease originating and progressing? Did the pain in the little finger or the thumb originate from an accident? In that case, it is a different remedy altogether. Whereas if that pain or that sensation is related to the herniation of a disc in the vertebra at a particular location, then it's a different story altogether. So pathogenesis is very important to be understood if we have to interpret and make sense of the symptoms presented by the patient. And lastly, he makes it very clear that morbid anatomy is not pathology. Morbid anatomy is something that you see in a morgue or a house for the dead, whereas true pathology is what is the response or the adaptive response of a living person with an active life force. Another great master from England was Compton Burnett, and he gives us a very good guidance on remedies. Naturally, as a homeopath, you will be taking down a case, you will be weighing the symptoms, determining its hierarchy, and then repertorizing. But when you make the choice of a remedy, we must bear in mind these points which have been underlined by Burnett. First of all, seat of action. The second thing is the kind of action that a remedy does. The third thing is the range of action. And lastly, what Burnett calls as the stop spot of action. We'll take each one of these one by one. The seat of action means that the particular remedy must have an association or an affinity for the affected part or organ. This is of great importance in most cases. The kind of action means that the symptoms of the drug or the remedy and the disease must be congruent. In other words, the symptomatology of the drug in its provings and those presented by the disease must be like each other. The third important point was the range of action, which means the drug must follow the pathogenesis of the disease. Now, in order to understand this term, let's try to go back to a very fundamental concept of homeopathy, which is provings. What exactly are provings? They are experiments done on healthy people, and they are watching the person who is a part of a proving is going to watch himself for symptoms as they develop in various parts of the body. We'll come back to this point a few slides later again. And lastly, he talks about a stop spot of action. In other words, remedies will only work up to a certain point, and they will not work beyond if we have not seen the pathogenesis of that remedy going up to that point. As an example, he gives in another book, Burnett mentions that urtica can help in a gouty attack, but it will not cure the disease, because this particular remedy cannot produce the symptoms of the disease itself, but it can mimic or come close to the symptoms which present during an attack. Gout is a systemic disease, but it has a wide spectrum of symptoms. And this particular remedy mentioned can help if the symptoms are matching during that attack. So it will not cure the disease, but it will help a patient during a gouty attack. Very important point to understand. Further, let's see what Burnett has to say on similarity. What Burnett says is that a remedy can have a pathologic similarity, a symptomatic similarity, or a simile similarity. A pathologic similarity means that the remedy matches the disease process exactly. A symptomatic similarity is that it matches the totality of characterizing symptoms. The characteristic symptoms are very close to it. And a simile is that it has a limited or a superficial similarity to a number of symptoms. It is important to keep this in mind because if our remedies don't act, or if they act only in a limited way, we should be able to find out from our analysis which other remedies come close to matching the disease process itself. Then we shall get very close to curing the condition presented by the patient. Now, most of the books that we read on provings, Allen, Herring, Materia Medica Pura, they are normally organized on anatomical regions of the body, starting from head to toe. But we do not have a clue as to how the symptoms developed over the course of time. We do not have a chronological order of the symptoms that appear. Now, Hughes was a British homeopath who took tremendous amount of pains to organize and write a book in which he was able to present symptoms as they appeared over the course of time. And that is a big guide for us when it comes to understanding the pathogenesis of a remedy. Take for instance belladonna. If you refer to this book, it says here that the prover in 3 hours after taking a quarter grain had a pappy taste, which means a distorted taste in his mouth, with white furred tongue and feeling of emptiness in the stomach. This prover continued with the proving, and when he took between 3/8 to 1 grain of that particular medicine, which is belladonna in this case, besides the foregoing, that means besides all the symptoms mentioned here, he experienced a dryness of mouth and larynx, hoarseness, collection of white tough mucus in mouth with frequent spitting, and the tongue adhered to the palate and appetite was diminished. So this is a sequential record as it happened. It mentions here the time and the dosage. Take another remedy, again from the same book by Hughes. The remedy in question is Bryonia alba. This also exhibits the same kind of symptoms. The peppy taste is there, but it happened to the prover after dinner, great distension of the abdomen, confusion of the head, thirst and peppy taste. Further, after half an hour, dryness of the cavity of the mouth except the point of the tongue. So this one gives a pretty peculiar symptom here. It gives us a time and it gives us a sequence of how the sensations, symptoms evolved and developed over the course of time. That's what pathogenesis is all about. Suppose we were to open the synthesis repertory and look for the rubric mouth dryness. We'll find a whole lot of remedies out here. And naturally, belladonna and bryonia, which we discussed here, also appear there. But there are so many other remedies as well. We have no clue about pathogenesis when we look at a repertory. Let's take the next symptom that we mentioned previously, the peppy taste in the mouth. Once again, belladonna and bryonia, both of them appear out here. The small subscripts that you see after the remedy are referring to the source. We'll take a look at that in a while. You will observe belladonna and bryonia come from Beaujeu. In the taste for the mouth, the peppy taste in the mouth, they come from Kent and they come from Kent. Let us remember one thing, that the properties of a remedy begin from a proving, then they are compiled into a readable volume known as materia medica, from which are extracted in a very succinct form and prepared into a repertory. So when we are looking at the repertory and we come up with a remedy that seems to suit the case most, we must work our way backwards to the materia medica. And if we are still in doubt, or if the remedy is not working or not working sufficiently, we should go back to the proving. And in this case, the book by Hughes is a wonderful volume, because that is the only book in our literature probably that tells us about the pathogenesis. So both the dryness symptoms in synthesis, as I told you, are from Beaujeu. The taste symptom for belladonna is from Kent, and for bryonia is from Pierre Schmidt. Apparently they are clinical symptoms because they don't appear in any other source other than the one which I quoted earlier about the provings. In synthesis, proving literature like the Materia Medica Pura, Herring, Hughes, Allen, they are not mentioned for these particular symptoms. Now, I mentioned earlier, the name of the book is Cyclopedia of Drug Pathogenesis. When he wrote the book, in the introduction, Hughes says that it's a narrative of all provings, stating the symptoms in the order of their occurrence, with such condensation as completeness allows. So it's a pretty big volume with very little stuff that has been summarized, but the important point is that it's in the order of occurrence. And the second point of importance is that it traces all versions and copies of the originals and verifies them for their correctness, and only then they are reproduced in this book. So this is one reference you must always keep handy in cases where you feel that the remedy is not progressing to the point of cure, or you wish to see why it is failing to do so. So I'll just recount the summary of what we have done in this particular video. We looked at the term pathology and examined its etymological roots to the word pathos, which comes closer to our understanding of disease in homeopathy. We looked at the word ponos, which is about the struggle or toil that the life force does in order to save the body. Then we took a look at pathogenesis, and we now understand very clearly that provings are actually a study of pathogenesis if we look at them from the point of view presented by Hughes, where he takes it in sequence of occurrence and not just anatomical regions. We also saw what Kent has to tell us about pathology versus morbid anatomy. Also, Burnett's views on the importance of the seat of the remedy, the range and the stop spot. And finally, the importance of chronology, as was mentioned when we talked about Hughes' book on the pathogenesis. So thank you very much indeed, and I hope this will help you to understand the case of lupus, which is part of the module. Thank you very much, and meet you on the forum. I'm looking forward to your posts and to your views and questions if you have any. Thank you very much, and bye-bye.